Look how hard he's squeezing. He's literally shaking. Ooh, that one shot a long ways. A pimple near the eye is really dangerous. Oh, I've seen this one before. The whole sac comes out. Nope, it's not the same one I was thinking. Boom, juicy. Oh, that is a long ingrown hair. Ooh. Be honest, which one of you guys would buy this thing just to do your own pimple pops at home? This is hilarious. Welcome back to the channel. I'm Dr. Dustin, board certified dermatologist, and I'm always talking to you guys about skincare, and now I can finally answer your questions. I am now offering telehealth appointments through the app called Future Clinic. I'm going to have the link down in the video description, and currently I'm able to offer telehealth to patients in Idaho or New York. More states are coming soon, so stay tuned for that. But if you're in Idaho or New York and you would like me to be your dermatologist, you can sign up through the link in the YouTube video description. This will allow you unlimited visits with me starting at $50 a month. The price may go up in the future, but right now we're rolling it out and we are capping the number of people that I'm able to see because I still work in my clinic and I'm a content creator. So if you would like me to be your dermatologist where I can write prescriptions and provide you skincare advice in Idaho or New York, hit that link and check it out. I've got some good ones for you today. Some of the best TikTok, pimple pop, cyst pops, extractions, ingrown hairs, all of the fun stuff that you guys know and love. Let's dive into the first video. Removing a pimple patch from a year-old pimple. Now I can tell you, if it's a year old, it's not just a pimple, there's something else going on here. So this is more of an ingrown hair and a cyst. And we can see the hair coming out already. Not just a simple pimple if you've had a lump under the skin for a year. Where's the gloves at though? I mean, this may be in the nether regions and there's no gloves on here. I don't like that. I can't quite tell where it's at, but I can see those nails and there's no gloves. Now we're straight up just using the nails to push this stuff out of here. Not a fan of that, you guys know it. Oof. The tweezer's doing nothing there. Might as well wipe it with a Q-tip. You know what this is. It says it just looks like a pimple to me. And I've had pimples like that and you just scrape them, they pop right open. It's not very satisfying. It's not a good pop. Using a comedone extractor on the forehead. Definitely seen people bruise themselves. Now we're using, I don't know what that tool's called, but I don't like those on the skin very much. And a different shaped comedone extractor. I would say it looks like they're being pretty gentle, so I do like that. And they're doing it on themselves, so, you know, no gloves, but still. If you're doing this stuff at home, you're piercing the skin, your risk of infection goes up because you don't have the type of equipment you need to sterilize these tools. After we use them on a patient, they all run through something we call the autoclave, and it completely sterilizes the equipment. Viral tweezers. Let's see what we got here. We're on the nose. Tiny little fine tweezers, and they're just plucking out what looks like a sebaceous filament. Pretty satisfying, just one. This just looks mean. Look how hard he's squeezing. He's literally shaking. He's trying to mash on that so hard. Ooh, that one shot a long ways. Inside the nose. Oh, that's a straight up infection. Go see a doctor. That's not just a pimple. A pimple near the eye is really dangerous. I agree, and this is not a pimple. This is a straight up infection. This person needs to go to a doctor. There could be a foreign body in there, but they definitely need antibiotics because an infection in that area has the potential to spread and do some really dangerous things. This is not a dermatology office. This looks like there was packing in a tooth. This person probably had some dental work done and that was packed. Maybe still kind of cool to see that come out. Now this is my stuff. Behind the ear, we've got an old cyst. You can see how much of that stuff is oxidized. Juicy one on the lip. tender spot. Oh, he's like amazed at it. Oh, I've seen this one before. The whole sack comes out. Nope, it's not the same one I was thinking. Back of the ear. Boom, juicy. Inside the ear. They got a comedone extractor. They're trying to give you a good view, and they got it. She's not even using her hands. This is the hands-free pimple pop. Just swipe it with a Q-tip. I fail to understand why people use these Hypercators to open up cysts. I think it just does more scarring on the skin when a simple needle poke would get the job done. So I don't like using them personally. They burn the top of the skin, and yeah, it opens it up, but this one's infected. That's straight up pus. That was just a push pin. Oh, that is a long ingrown hair. Ooh, be honest, which one of you guys would buy this thing just to do your own pimple pops at home? This is hilarious. Boom. He recovers great. I mean, the skin's like perfect right afterwards. It's pink. We got a new one. Oh, in his eye. Big pimple on the lip. Boom. Stuff's getting everywhere. That was a black one. Not the eyeball. Just ruptured the globe. Oh my goodness. Boom. I mean, this would be a satisfying toy to play with, but that stuff is going everywhere. Are you gonna clean that up? I kinda want one. OMG worms. Kinda look like little worms, but these are sebaceous filaments. You don't need to extract these. You need skincare to reduce congestion, minimize the appearance of pores. But they do look like little worms coming out on the skin. Confession time. I used to do this kind of stuff to my own nose when I was in college. I'd squeeze all those sebaceous filaments out. But I don't have to do that because I'm really consistent with using a retinol, some glycolic acid in my routine. I keep my skin clean. I keep it moisturized. And I have way less need to do this kind of stuff and mash on my skin. A pimple inside the nose. This looks more like a tiny abscess. The dude's got nose hairs galore.
So you were holding it?
Trim those nose hairs. All right, we see it. Are we going in for it? You know, some guy, his girlfriend just made him lay down. She's like, I'm getting that thing. And she just got just like household splinter tweezers. She opened it up though. She's being pretty gentle, but I mean, there's so much bacteria that live in your nose. You gotta be super careful. Now we're coming in with the comedone extractor and oh, he's not having a good time. His eyes are watering now. She got the stuff out of there though, and ultimately it is probably gonna feel better.
No, please. It's gonna hurt like a bitch.
It is gonna hurt like a... Now I've seen videos like this before. This can be a real medical condition like psoriasis or really bad seborrheic dermatitis that leads to intense buildup of scale. However, there are creators out there that will put things like soap on their scalp and allow it to dry, and that will flake and crust in a very similar way. And unfortunately, in a video, it's just hard to tell. This is a lot of flaking on a scalp that otherwise looks pretty healthy. So I'm kind of leaning more towards this is fake. This guy's got a cyst on his neck and he is letting his buddy just mash on this. Oh, it's shooting all over. It's getting on his shirt, on his buddy's fingers. Oh, I can see a beer on the counter there. I think some alcohol had something to do with this. Guys, thank you so much for watching the video. I have a great time watching these with you. I hope you learn a little bit along the way. And remember, if you want me to be your dermatologist and you're in Idaho or Utah, click the link for future clinic. I can evaluate your skin, send in prescriptions, make over-the-counter recommendations for good skincare routines, and all of that. Unlimited visits can be yours if you sign up at the link in the video description. Thank you so much for joining me, and I'll catch you guys on the video next week.